will continue to evolve is what we call at the intersection of food and nutrition. So in healthcare, that's really what we're trying to do, is improve the health, well-being, and nutrition knowledge of the patients, communities, staff, and students and things that we serve. So it's really trying to meld the two of them together. And I've been in the industry for a long time, and probably not until the last 5 years or so have you really started to see those come together in a very strong way, whether you talk about local foods or whether you talk about how do we combine education and choice at the point of service where people make selections. So I think that evolution will continue to be very, very strong. And we are at a very unique position because we not only have the food experience behind us. Here in my job at Ohio State, we have more than 50 dietitians who can actually promote the nutrition message that goes along with it. In our department, we receive over 9,000 messages a day about patients, their diet order, and their room location. We alter the food production methods to usually lower the fat and the sodium wherever we're able to make that more universally acceptable. So a couple of things that come into play there. We do really like oven technology, and really combi technology, because of the steam that we can introduce back into the food. So things where fat might normally serve as a great agent to keep that food moist, because we've removed some of that, we're looking to keep it moist through steam. Sustainability and local purchasing is very important to people today. You always talk about what the top trends are. Knowing where your food comes from is definitely on that list. And I think it will continue to grow as we're trying to phase back into what that means for the individual clients we serve. But it is a bit of a challenge, to try and buy that way, because the last 10 to 15 years have been about making efficiencies out of our supply chain. So now we're going back to say, how can we move that supply chain more local? So we have a lot of ongoing discussions with our distributors, our suppliers, to try and answer those questions. But I feel like it's also a larger challenge for the vendors who we do business with, because it's asking them to do work differently. So it's balancing that dynamic of local to efficient. And in healthcare, we also have to add that element of food safety